Today, I'm sitting down with one of my wedding clients. She is a board-certified nurse practitioner at the Ozzie Smith Center in Chesterfield, Missouri, where she treats patients with spine and joint pain non-surgically using regenerative medicine. She recently started her own company, Mad Aesthetics, which takes the same regenerative medicine and non-surgical techniques to improve the cosmetic appearance of her patients. She helps men and women age gracefully and feel confident in how they look, all while mitigating the risk associated with going under the knife. In this episode, we talk all things PRP, vampire facials, preventative skincare, non-surgical breast lifts, O shot for women, P shot for men, and how to age gracefully. I am so picky about who I see for services, and Maddisson is one of those practitioners who genuinely cares for her clients and spends time with you to make sure you're going to get the desired results. Not only that, but she is so personable and likable. I loved having her as a client so much. We became friends throughout it. So I am honored to now have her as a guest on the podcast. With that, welcome Maddisson Haslett-Warren. So before we get jumped right into everything, I want to talk about your honeymoon.
Oh my God.
Because you went to the Bahamas.
Yes.
That is like one of my destinations.
So
how was it?
we had a travel agent and I said, we are not looking to do an excursion. I do not want to hike anything. Please don't make me do any work. We are just here to relax, and my husband's the same way. So she gave us a couple options. We had done Jamaica a couple years ago together. Loved it, but we were like, let's step it up a notch a little bit. So she was like, why don't you do Nassau and do the Sandals Resort there? And I was like, oh, girl, you know what you're talking about better than me, so let's go ahead and do it. It was literally phenomenal. Phenomenal. I would recommend everybody go back there, 10 out of 10. I would say we went in January. We got married in December, went in January. I would definitely go back in like March, April when it was a smidge warmer, but the food was fantastic. Oh my God, the drinks were fantastic. Every day at the pool, they had a little bottle of champagne on ice for us, 8 o'clock in the morning. I'm like, I'm not complaining. I'll open it right here now. So yes, I would highly recommend if you've not done Bahamas, go, please.
Did you swim with the pigs?
No, because
Okay,
my
'cause
husband.
that's one of my things. Like when I see the Bahamas, I think swimming with the pigs, and I'm like,
I
have
showed
to
my
do it.
husband a pig, and he was like, "That's big. That's bigger
That's a
than I
big
thought."
pig.
So I was like, and I was a little intimidated too. So no, we didn't. But we'll 100% be back in the Bahamas. So then maybe we'll finally get off our butt in the chair and go do some excursion of some sort. But no, we
Yeah.
loved it. Absolutely loved it.
And there's a lot of history there in Nassau. Isn't there?
Yes. And
Yeah.
everybody that worked at the resort was so willing to to tell you all about it. We would take a drive and because they have, the service that picks you up from the airport, and he would be like, this movie was filmed here, and this movie was filmed here, and this is what we call this. And so they were super helpful. And I mean, you definitely leave there knowing something you didn't know before, which I always try to be respectful of the culture and just learn something while I'm there that I can pass on to somebody as like a little fun fact.
I'm a history nerd, so
are you?
like, I love it. Anything that I can learn while I'm at somewhere that I know has a ton of history,
Yes.
and from like way, way back type of history.
Have you done Jamaica?
No.
You would love. Oh my gosh,
Really?
for the history alone, yes, you would love Jamaica for that reason. I think
Okay.
they do history tours. Actually, we went to Montego Bay, and you could just get on a bus and like go downtown, and some guy would be like, "Here's and tell you about where Bob Marley performed, when he was
Oh, yeah.
younger." So I think you would really enjoy something like that too. Love the
Ooh.
Caribbean.
Okay, yeah, I'm all for it. We're looking for some new destinations
Oh
because
my
we do Mexico. We've done Mexico so
Yes,
much, and so I'm
yes.
like, okay, let's go somewhere
Definitely
different.
check it out. Our goal
Yeah.
is to just keep going like more south in the Caribbean as we go.
Oh, okay.
And I've heard Barbados is like the place to be.
Mhm.
So I think eventually on our bucket list we've got that. But yes, definitely do anything in the Caribbean. You won't be disappointed.
Yeah. All right. Well, we'll get right into what you're here
You got
for.
it. No, I love
just
vacation
had to
talk
I had
too.
to check with that because I was like, oh, I know you went to the Bahamas.
Yes.
I have to know. So
You would love it.
So moving on
Mhm.
to everything that you have to talk about, which I'm so
Yes.
excited about because I am I'm here for like skincare,
Mhm.
how to age gracefully. And you talk
Yes.
about that a lot, is
Yes.
aging gracefully.
Yes.
So can you talk more about that and what you mean by that when it comes to the services that you provide?
So I think that I get a lot of women who are in their usually like late 30s to like early 60s. And they're like, I just don't look how I used to look. My self confidence is taking a hit. But they're very against doing any Botox or filler. And I'm not here to bash any Botox or filler. I get Botox in my forehead. I will always get it in my forehead. I love it. However, there are other things that we can do, especially with those women who are scared of Botox, who are scared of filler, who are scared of the migration, the occlusion that can occur with stuff like that. And so what I tell them is my goal as a nurse practitioner and now an aesthetic provider is to say, I don't want people to ask you where you're getting work done. I want them to just kind of look at you and be like, what are you doing? They can't
Ooh,
exactly
yeah.
pinpoint it, but they know you're not getting any type of plastic surgery or any typical injectables. So they just kind of look at you and they're like, "What are you doing?" So with my company, I've been an orthopedic nurse practitioner for the last 2 years where we specialize in PRP, which is platelet-rich plasma. I have been using that in my orthopedic patients for those that have joint pain, who have back pain, who have neck pain. And our own PRP is so fascinating because it has all these growth factors that our body needs. So we can literally take a damaged knee, for instance, that's been riddled with osteoarthritis and heal it from the inside out using our own growth factors. So I got to thinking about this and did my own research and was like, why can't we do that cosmetically? Who knew outside of St. Louis there's a whole world of this and nobody's really tapped into it in this market. And so we can actually take our body's own natural growth factors, which allow new blood vessel production and collagen production, and inject them in the face to give a more natural, glowy, bright, youthful appearance. And women love it.
I love it.
I
I love hearing about it.
I
This is
know,
amazing.
yes. And I just don't want people to think that they have to go Botox filler route if they don't want to. There
Mhm.
are alternatives that are safe, and I don't put anything in it. No preservatives, nothing's added to it. It's just you and your own body.
Yeah, I love this because I'm a Botox girly.
Mhm.
But if there are things like this that I
Yes.
don't have to necessarily put toxins into my
Yes,
body,
yes.
I would love to go an alternative route like this. That's
For
amazing.
sure. And Botox is good. I think for me, it was before my wedding I started. And so I kind of did it before any of the fine lines wrinkles took place. But one thing that really bugged me about my skin was my texture. And I think that's what a lot of women struggle with is skin texture. They don't like pore size or they're like, this is rough right here. That's where this stuff is like gold. Literally healing your body, healing those areas you don't like from the inside out, and it works. I mean, it's mind-boggling, truthfully.
So can you explain more about the PRP
Yeah.
process? Because like say I'm coming in and I'm
Yes.
like, I want to do a PRP process. Like
Yes.
what does that look like for me?
So typically what I do with all my aesthetic patients is we sit down and I say, what's your goals? And like the example we just used, if you said, hey, I don't like my skin texture, I have an acne scar here, it really bothers me. Nothing that you say, even if I was like, oh, it's not, if I think in my head, oh, it's not that bad, if you came to me, sat down in my chair, made an appointment and you're going to pay for a service, then it's my problem too. Because I'm never going to look, I think that's something about women is they're like, I don't like this line. And people are like, oh, that line is fine. Well, to her, it's not. And then it should be addressed and her concerns are valid and we go from there and we treat it. So if you said my pore size and my skin texture I don't like, I hate when I put my makeup on, you can see it looks cakey, blah, blah, blah. I would say, okay, let's do a PRP facial. A vampire facial is the big trade name. And so what that would look like is you would sit down, we would talk about your current skincare regimen because I'm curious what you're using. Maybe something isn't right necessarily for what we're going to be doing. And then we talk about if you're on any Accutane or any prescription retinols. I usually have you hold those for 2 weeks. Then you'll sit down, we'll do a numbing cream to the face. While you're numbing, we'll draw your blood. The blood spins in a centrifuge for 8 minutes.
Is this like blood out of your arm?
Yep,
Like,
just like
okay.
a normal,
Yeah.
just like a normal vein. Mine's looking good today, but just like a normal vein. And we don't take a lot of blood. People are always kind of scared about that. It's like literally a 20 cc tube, nothing. And then we will take the blood, spin it, spins for 8 minutes. Your red blood cells are heavy. So when it's spinning that fast, they will sink to the bottom. Your platelets and plasma will go to the top, and they're like a rich golden yellow color. People are like, is that pee? I mean, it literally is like neon yellow color.
Oh my gosh.
Yes. And so then that is what we use to inject back into the face.
Wow.
Mm-hmm.
And this is all done the same day? Like,
Same
it's not
day.
like you have to do the blood draw a different day?
Nope. This is done in an hour tops for most of my patients.
Wow.
Mm-hmm.
So I know one of the things that you offer are the PRP under eye.
Yes.
Can you explain what that looks like? So you explain drawing the blood.
Yes.
What does it look like going in and doing it?
So for the under eye, I would say a lot of the complaints are going to be like the puffiness, the fine lines, the wrinkles, and darkness a lot of the time, which are all things we can fix. But if I'm going to go in there, you're already numb, and we're going to inject your platelets, we're going to do it right. So we're going to tackle definitely injecting under the eyes, where most people get like the bags, the puffiness. Then we're going to tackle crow's feet. I usually have them smile, get those wrinkles, get crow's feet here. Then a lot of women forget about, everyone hates these smile lines.
Mm-hmm.
Where is
I
that?
struggle with the smile lines.
And where are those coming from? That's gravity. People think it's just here. No. So if you take these cheekbones just a little bit, put a little PRP, give a little collagen production, lift those cheekbones, you're lifting all that up. That's gravity.
Oh, okay.
So people just want to kind of spot target this, and they always want me to inject PRP. You can. Not going to make a difference. I mean, it's not going to hurt it. It's going to help it as well. But if we attack the source and give you some brightness up here, you're kind of killing two birds, one stone.
I love that.
It's amazing.
Because, so one of the things that I've noticed in
Mm-hmm.
my own aging is underneath my eye is kind of like sinking a little bit more. And
Mm-hmm.
so I actually saw someone post from a med spa that I follow about injecting the filler right there. And
Mm-hmm.
so I was super nervous about that idea.
Right.
And so this is awesome, though.
Yes.
That you can do this process to help that. And
Absolutely.
that will help the deepening of that?
Absolutely.
Wow.
So basically what you'll do is, again, when you go and inject PRP into that soft tissue, our body's calcium is going to naturally go to that, just like it does when I inject a back or when I inject a shoulder. Your body's own calcium goes to that PRP and it activates it, so to speak. And what that turns that into is instead of a PRP, which is a liquid, it turns it into a PRFM, which is a fibrin matrix. So it literally turns it into this basically gelatinous type of texture. That is what is going to create collagen from underneath. So it's kind of just using your own body's natural healing growth factors and then letting your body process it how it wants to naturally process it in order to get those results. Basically, the only thing I have to do is just inject it where the problems are, and your body takes care of the rest.
Yeah. Is there anyone that is not a candidate for this type of stuff?
No, because it's your own
everybody.
body.
Okay.
I will say that anyone who is because I really treat anybody. The only times I really don't treat somebody is if they have an active infection, just because we don't want to be using your own platelets and plasma while your body's trying to figure that out.
This could be like any infection within the body, like a
Yes.
bladder infection.
Yes.
Okay.
If a girl came to me and she wanted a facial, but she had a UTI, I'd be like, let's just get you through the UTI, and that's probably me being overly cautious. I don't think any other providers would really blink an eye. We take the best road possible because we want the best results. But I will say that if you are a type 1 diabetic, they have more significant issues healing. And so they would be somebody that I would maybe expect to have a prolonged recovery time, but not that they could not do the procedure.
So what is a vampire facial? Can you go more into that? 'Cause
Yes.
you mentioned it already,
Yes.
but I want you to go a little bit more in depth.
So in vampire, the whole vampire name, that's the Cellular Medicine Association. Dr. Reynolds, he coined all these terms, and I'm certified by the Cellular Medicine Association.
I've heard this term, and it has always freaked me out.
It's scary.
Because I feel like this is where I'm going to come out looking like blood everywhere.
I'm going to be honest. You don't look great leaving my office, but I clean you up to the point where you can put a hat on and sunglasses on and go home and you'll be fine. But what we do, same process of drawing the blood, We numb the whole face, and then I have a microneedling pin with a cartridge. Depending on your goals, depending on your skin texture and what you've kind of done in the past, there's 3 different types of needles I use, and that just is more for if we have a patient with a lot of acne scarring, I'm probably going to use maybe like a 24 needle cartridge, and then my speed and depth and everything will depend on you. We go pretty easy on areas like the forehead because there's not a lot going there. We don't want to hit too deep.
Oh, yeah.
But like cheeks and chin, and even I do the neck and the chest for women who have crepey skin. We'll take the microneedling pin, we'll take the cartridge, go over all of those areas. I do a horizontal, vertical, and then we do diagonal both ways. And that's just to make sure that we have enough hemorrhages per centimeter to where we can take that PRP and then put it in those micro hemorrhages. Some people will microneedle with like a gel or some type of substance that glides. You could. I have patients who maybe are super dry, and I can needle them with hyaluronic acid because you want something lubricating enough to where you can move the needle effectively. I personally take their own PRP per area, cover. If I start with the cheek, I'll take the cheek, cover it in PRP. I will microneedle that PRP into the skin. Once I have the bleeding and once I have the hemorrhages, I'll take the PRP and then press it back into those hemorrhages and let it sit and dry.
Yeah, like a double dose.
Literally, we're microneedling it deep in, then we're filling those holes. So I do that all around the face, the neck, the chest. And you definitely feel, I mean, you're looking a little red, but you're not. I think people let people leave like with blood pouring out of their face. I will never do that. You're definitely red. You can see a little bit of dried blood, but you're not leaving like looking like you were in the last scary movie that came out, you know?
I think it's just the vampire name that makes it sound so much more intense than what it is.
Oh, I know. And people are scared for that reason. And that's what I want to get the word out there that like, this is not scary. This is stuff I do to myself. I needle my own face.
I've had microneedling done and it is not bad at all. Like it's not painful.
I think Botox is more painful than a
10 times.
microneedle.
10 times.
Isn't that crazy? I know people are like, it's going to hurt. I'm like, you're not even going to notice. The vibration's a little weird for the first couple minutes. I think some people are weird about that. Otherwise, I've never had anybody be like, ouch, that hurts, or complain that it hurts at all.
Yeah.
At all.
And then they see their skin afterwards and they're like, oh, I'll do that 10 times over
exactly.
again and again.
And other than I'm a stickler about sunscreen after, you cannot get your face in the sun for at least 72 hours. You have to be diligent. Otherwise, the recovery time is fantastic. Most of my patients aren't even red after 24 hours, which is amazing.
I've heard microneedling be done on C-section scars. Is that something that you do also with this process?
Scarring is fantastic. My mom actually had basal cell on her face right before our wedding. And so we did a little bit of microneedling with PRP, and you wouldn't have even noticed that she had a huge procedure on her face. I have women who have had surgeries where they have like a laparoscopic surgery. They have a little incision on their belly and makes them self-conscious when they go out in a swimming suit. So yeah, you can needle scars. Does take time depending on the size and the depth of the scar, but super effective, and stretch marks too.
Wow. Okay. So we do this on the face.
Yes.
You have vampire facial.
Yes.
So I want to move on to vampire breast lift.
Yes.
Because when you told me this, I was like blown away. I've never heard of this. So this was wild to me.
Yes.
Because it's a non-surgical way to basically get
new boobies.
Great boobs.
Yeah, exactly.
So, can you go more into that of how that process works?
So actually this was something that obviously I learned and was certified to do, but I was still like, come on, like no way. So I had a couple women that I worked with at work, and they were all my guinea pigs for all of this, those poor women, but they love it, thank God. And one of them, she had actually lost roughly like 75 pounds, and she had babies. And so she was very saggy in her words. I was like, you're beautiful. But, you know, she was very self-conscious about it. More had like the egg shape. So she felt like she had enough to put in a cup, but she had no protrusion from the top. And she wanted a little bit of roundness, some fullness. And so she had looked into breast implants. However, she has multiple sclerosis. So she was not a candidate to get breast implants. They figured that her body would reject them and it wouldn't work, and it was too dangerous for her. So she needed an alternative. And we have done hers. now twice, just because I think the first time she was such a guinea pig. We were just kind of like, let's figure it out. We just did hers a second time, and she has never been more happy. I mean, she fills out her bras. She has a full cup from the front and from the side. She's a little more lifted. She
Wow.
she can wear a swimsuit and not feel like she's constantly, you can see a woman do the scoop. She's no
Yeah.
longer doing that. And it really helped her confidence. And even her husband, she didn't tell her husband she was going to do it. And he was like, what did you do? And she was like, Maddie gave me a breast lift. And he was like, they look great,
Oh, wow.
So, and then just,
So it's fullness and a lift. So
Yes.
it puts them where they need to be.
Yes.
And adds extra.
Because if you think about all that connective tissue you have there over time, which, fun fact, we lose all the blood flow to our connective tissue after we're 19. So we're all just kind of like slowly dying inside. All this connective tissue. That's why you look in your science books and your muscles are all red. Well,
Mhm.
everything else is white. It's because it's dead. It doesn't have oxygen. So you think all this connective tissue that's supposed to be holding these up has now over time lost blood flow and is more lax. So you give it that blood flow back from the PRP, which creates new blood vessels, which also creates collagen. You're not only helping the body lift it, but you're giving it fullness here.
This is amazing.
Incredible.
My eyes are huge right now because I'm just
Incredible.
like, how
Yeah.
is this?
Well,
That's
and for
crazy.
women who are scared to go under the knife, or
Yeah.
who don't want implants, or maybe had implants, they got them out because they didn't like them. I think it's a great alternative.
Yeah. So will this work on women who haven't had kids and really they just have small boobs
Yep.
and they want to have bigger boobs?
100%.
Okay. So it
100%.
doesn't need to necessarily be like putting them back to where they were.
Exactly.
You can grow them basically.
Exactly.
Okay.
And I do tell women that I don't go crazy. So if a woman's adamant that she doesn't want her cup size to increase, totally fine. It's just a matter of where we inject it. But for those girls who are like, I want to go up a cup size, easy peasy. Easy.
Yeah.
I just ask when every woman comes, bring your favorite bra and your favorite swimsuit. And then we can kind of compare.
Oh, okay.
Mhm.
So there's like multiple times. You do multiple times because I know you mentioned that this is the
breast
second
lift?
time.
For her, because I think the first time she had lost all this weight, we were still kind of trying to figure out what my method needed to be with this. So she wanted to do a second time. The other woman at my work that I did, she did hers one time. Fantastic. I told her maybe do another one in 1 to 2 years is the
Okay.
only follow-up I would recommend on that.
So you can do it more than once. You don't necessarily need to.
Nope.
Wow.
And the only reason I say to follow up and do that every 1 to 2 years is we all want to defy aging. With aging comes gravity. So I would say just to keep things where they are, to keep them maintained, follow up every 1 to 2 years and do another one.
So aside from the breast lift, what age would you recommend people starting to get like the vampire facial?
I wish I'm 27. I wish that I would have done my first facial when I was like 20, 22.
Oh, really? So,
Yes,
okay.
because I remember being so hard on my skin. I mean,
Mhm.
me and my friends would go lay out at the pool. God, you didn't wear an ounce of sunscreen. You didn't put anything on your face. I would just burn my
Tanning
face.
beds.
Yes.
I mean, that was a whole era.
Yes. And now I don't
Yeah.
leave the house without sunscreen on my face. And on my scalp and stuff.
Mhm.
So I would say I wish I would have started much earlier than I did, like in my early 20s. Just like I'm glad people always are like, you don't need Botox. Well, you know what? I had frown lines. I didn't like them. And so I started that when I was 24, and I'm glad I did. And I'll keep doing it, but the vampire stuff, God, I wish I would have done years.
Well, and there's
years,
a
years ago.
misconception too, because I think a lot of people think that you don't need to do like Botox or like the vampire
Mhm.
facial until you need it.
Yeah.
But it's preventative.
Exactly.
Yeah.
Exactly. And again, if you create this collagen, just like you said, if you create this collagen underneath the skin, you keep it there, you
Mhm.
maintain it over time, you're not gonna have a wrinkle to even talk about in 20
Yes.
years, which is fantastic. So I would recommend, I mean, you think about, I put this in perspective. I'm totally price transparent. I do not beat around the bush with what stuff costs. My vampire facial with your own PRP is $700. There are girls out here my age getting normal facials every 3 to 4 weeks at $100, $150 a pop, I would imagine. So that's roughly, I mean, you're half the year and you've already paid for what I would do to you. So I think it's really worth worth the investment.
Mm. And how often would you recommend getting these? Like,
Yearly.
Oh, yearly. Okay. So
Yearly.
you're not getting it every 6 weeks. You're getting it once a year.
Once a year.
And wow, okay.
Because we make it count when we're there.
Yeah.
You know, I mean, if you have significant acne scarring, I might say come back in 4 or 5 months if you can, and if finances allow and you have the time, just so we can hit that acne scarring a little harder. Otherwise, if this is preventative maintenance, once a year.
Yeah, that's not bad at all.
Not
then.
at all.
I mean, when you consider going from if you get it every 6 weeks or you get once a year.
Yep.
Yeah, you can definitely fathom
Absolutely.
spending that
Exactly.
for sure.
I can rationalize that all day.
Absolutely. Okay, so we're going to move on to something a little bit more risque to talk about. So this is like one of those episodes that I hope my grandmas are not listening to because I'd rather not. But
I get it. No, I get it.
But I want to talk about you offer an O shot for women and a P shot for men.
Mm-hmm.
So let's go into all of it. So
we'll
talk about each one. We're going to talk about what it is, who it's for, and how to know that you are somebody who possibly needs it.
So we'll start easy with the men with the P shot. So we all know that in order to get an erection, you have to have blood flow to the penis, right? However, with aging and with time, this blood flow in some men will slow down. So maybe they manifest this in the form of not being able to get an erection. Some of them will get an erection. It's just not as hard as they would like. Some of them maybe can never finish, right? So these are all problems that men will come to me and have. I think a lot of men would like this to be for aesthetics, but really, truthfully, this is for function. And so what we do is, if you think about the same PRP, what does PRP have? It has growth factors. PRP will also result in new blood vessel formation. So if you're putting PRP into a man's penis, we're going to create new blood vessels. New blood vessels equals more blood flow. More blood flow equals a harder erection and usually easier time ejaculating. So men love it. I will say that it does, typically in most of my patients, it does add girth. It will not add length. I have men ask me all the time if it will make it longer. No, it will not make it longer. If it was, I would have already quit my job and I'm a billionaire. Yeah. So, God, they all ask. But really, truthfully, I've had men come back and just say that their sex life has changed dramatically. And these are people who can't take a Viagra. Or a Cialis. They're on blood pressure medicine. They've had a heart attack. They're not going to be able to take anything like that or be cleared by their doctor. So, and then what are the other options? I mean, like there's sprays out there, I guess, but nothing's treating the problem. This is a lack of blood flow that's causing this. Give them blood flow, fix the problem. And this is a one-time deal.
Yeah.
One-time deal. They do one shot. They're completely numb. Not a single man.
That was my other question. I was like, this gets injected into the penis.
Yes.
And are they numb? Like, do they? Oh, I'm just like,
four total injections in the penis. They are completely numb. If they're super anxious, we can do a nerve block. None of my men have ever needed it. And they are all, they leave the office looking at it and they're like, oh yeah. Because you can tell immediately that it's thicker, for lack of a better word.
Wow.
So, and I have my patients, they text me all the time and they're like, hey, it's still working great. Love it. And it sucks because like men don't gossip to their friends like women. So I'm like, go tell your friends. They're like, we don't talk about stuff like that. I'm
I
like,
don't
well,
know
go
that
tell
we have
them
a ton
anyway.
of men listening to the show, but
if they are,
I hope they are.
If they are,
and
go get your P shot.
Yeah. It doesn't need to be. I mean, it can be confidential. We don't. You
my
don't
God,
need to talk about it to everybody.
Yeah.
Obviously, they're confidential when they come to you.
I just think men take it so personally, which how could you not? If you're not able to perform like you want to. And mind you, there are other things. I mean, I do labs also at my clinic. We can check labs, make sure testosterone's looking good, other things like that. But truly, if it's a mechanical function problem, that's nothing they could have done differently. That's not their fault. But let's not let our pride tell us that we can't have somebody help us and do something about it.
Yeah. Yes.
Especially if it's so easy. The whole procedure's like half an hour. Easy. And no downtime. You can have sex that night.
Oh, even better. Okay, that was
Mhm.
my next question is like, what does the recovery look like? Like, what's the
They
downtime?
might be sore. I would imagine most of my men are probably a little traumatized by me that day. They're not gonna let anybody touch them. I do like men, and I provide it at every appointment. I do like my men after the P shot to use a pump, a penis pump, twice a day, 10 minutes a day. Are all my men compliant with this? Absolutely not, and they do just
Do
fine.
you give this to them when they
I supply
leave?
it.
Okay, I
Yep,
was gonna
I
say because
supply
men
it.
will not go buy this.
No,
Like
I
they.
supply it and I
Okay.
teach them how to use it. And then I talk about why. So if you think about, I just put all these growth factors in there. We want more blood flow. A pump is only going to take those new blood vessels and give them blood flow
Mhm.
and really get things sparked and going. So all they have to do is just use it till they see it engorged. Hold the little lever to stop the air. Keep it there 10 minutes. Release. You're done. Do all of them do it? No, because they're men and they're not compliant. But it does really help the process. And no one's ever told me they've been sore or anything after. So yeah, they love it.
That is great.
Love it.
Yeah.
And women with the O shot, we overcomplicate women, I think, too, because I don't know if you've ever looked at a diagram of a penis and a clitoris. It's the basically exact same thing. The exact same thing. If you look at the internal structure of a clitoris, it almost looks just like a penis.
Mhm.
So we tend to overcomplicate this. And you have my main clients that do an O shot are women who have had babies, specifically more than one baby. And they are peeing themselves every time they cough, sneeze, jump, do a burpee in workout class, or laugh too hard. They're peeing themselves. Or they're the people that laugh and cross their legs, or
Yeah.
hold themselves. So those are a lot of my women clients. But also I have women who will say that they're engaging in sex with their partner and they can't ever have an orgasm, vaginally or clitorally, which in my opinion, that is just unacceptable. We all got to do it. So it's a hierarchy of needs, and Maslow's hierarchy, sex is on there. So I just think women, again, beat themselves up, kind of like men do. And they have been told for years and years and years by OBGYNs and different physicians, like, oh, you had kids, like, you're just going to pee yourself now. Like, this is your punishment for birthing a child like a superhero, right?
Mhm.
And so what we can do is, again, if you've had babies, obviously that muscle tone isn't quite there anymore, and that's why they're having issues with holding their bladder. What you can do is actually put PRP in the anterior wall of a woman's vagina, and what that will do is, again, give you blood flow to the area. It's going to help that connective tissue. It's going to keep it strong and then build collagen to give it tone. You can also inject that directly into the clitoris. It sounds literally terrible. You are totally numb. Inject it into the clitoris. Again, same thing like a P shot. You're putting blood flow, new blood vessels, and collagen into this area that needs blood flow in order to climax. So it's really, truthfully, they're not that much different. It's just women experience a lot of incontinence after they've had children. And that may also kind of help prevent their sex life from taking full form like they would like to. So if you give them all these this help, these growth factors, this collagen to tighten them up, give them more blood flow to their sensitive areas, life-changing. Life-changing.
So this will this help like your pelvic floor? Because I know that's something that a lot of women struggle. Like I
Yes.
know it's something that I've struggled with after my
Mhm.
C-section
Yes.
was like having no pelvic floor strength.
Yes.
Like whatsoever.
Absolutely.
And like I notice it when I work out at the gym too. Like
Mhm.
my lower abdominals, I've had no strength in there, and
Right.
it feels weird when I work out. And I also started having like horrible periods.
Mhm.
And so the more I started reading into it, was a lot of it was pelvic floor. Your
Mhm.
pelvic floor is weak and it needs to be repaired after the C-section, because I never had that after my son, because I had him
Right.
vaginally. And so that was normal. Everything was good after that. Like I
Right.
didn't really have, and I was also 20 years old. So
Of course.
everything went right back
It's
to normal.
different, right? Yeah.
But then my daughter, she was a C-section. And so I feel like things just healed totally different
Oh,
with her.
absolutely.
So
Absolutely. And yes, I mean, I tell women all the time, we work very closely with a pelvic floor physical therapist, and truthfully, it is like one problem or the other problem. And she can tell. She does a quick pelvic exam. And then usually it's like 2 or 3 visits. And these women don't have to deal with this anymore. So if I have like an extremely difficult client who we've kind of done everything and we're good, like she's happy, but we could be better, I always advise them to see a pelvic floor physical therapist because I do think it is so important. But again, it's just been like kind of wrote off. Like if you feel that difference, you've had 2 children and you had them years apart and you could tell a difference in your body, how it responded, that's something to take note of.
Right.
And be like, okay, you can feel that. And I've never had children, so I don't even know how that feels.
It is so true, though. Like, as moms, we just write it off. We're like, oh,
yeah,
well,
I had a kid.
That's just how we are now.
Yeah. And that's what I don't want women to do, you know, whether it's with their, with sex, whether it's with how they look. I don't want anyone to think like, oh, this is just kind of what happens. Because it's not. It is 2024. This is why we're doing stuff like this. You know, this is why I took this leap to be able to give people other options rather than just kind of what's on the market now.
And show them there are solutions
Gosh,
without
yes.
thousands and thousands and thousands of dollars and surgeries and all this craziness. Yeah.
Yes, women will go get bladder mesh. And then what happens? They develop a terrible infection. They're septic. You know, there's so many cons to surgery. So if I can do anything to help somebody avoid that, that's why I'm here. That's why I'm put on this earth, I think.
Yes, I think so. I mean, this is
know.
amazing. Okay, so we're going to switch back to skincare.
Yes.
And I want to ask you, what are your skincare products, brands that you swear by? Like if someone listening is like, oh, I want better skin, they're coming to you to get the vampire facial. What is your go-tos?
It is funny how many, not funny, I guess, but interesting to me how many women do not indulge in skincare. Like nothing at all. Like maybe we use a bar of soap in the shower.
That was
and
me
I'm
like 5 years ago.
Really?
I was so bad.
Man.
I was the girl that like would go to sleep with my makeup on.
Oh, well.
And then just like deal with it in the morning.
Yeah, on a certain night. I can't say that maybe I didn't do that a couple months ago. We all have our slip ups. But I would say, so I'm kind of, I might be an unpopular opinion about this. I think that our skin changes and our body changes, and I feel more like myself and physically, mentally, spiritually, emotionally healthier than I did when I was 20, 21. I think my whole body has changed, including my skin. So I'm not one to stick to the same regimen all the time. I'm very bad about that. And I know people have their tried and trues. I actually, for the last 6 months, I have been doing something totally different. My skin's never looked better. Right now, the brand that I am obsessed with is La Roche-Posay. Very affordable brand. You can get it at Target. You can get it same day on Amazon. We all know we need everything same day on Amazon. I am using their cleanser, their mild cleanser right now. It is so foamy. It's so hydrating. And then their moisturizer. I will say that I did get into like the snail mucin trend. I do really like it. I love it.
One of my girlfriends is an esthetician and she swears by this too. And the under eye patches. It has it in there.
Yes.
Yeah.
I do like it. I do have the serum still, but I did switch. I do the La Roche-Posay cleanser, and then I do a snail mucin toner and pat that into the skin. I do my hyaluronic acid on top, and then I do a moisturizer. I keep it very, very simple. I think we kind of see these, you know, like Clarins double serums and all these vitamin C's and all this stuff. And it's overwhelming for people. And I think that's why women don't do anything about it. Because they're like, I can't buy all these products and do everything. And I'm like, just make it simple. Find out what your body needs. What is your skin asking for? For me, I'm dry usually all the time. So my skin's asking for moisture. So I center my products around moisture. And I'm doing right now on my Instagram like a summer skincare series because I've just fell in love with so many products recently. And like the e.l.f. Wow Glow sunscreen.
That's great to mention because I feel like I use different stuff for each season.
You have to.
Yeah.
You have
Because
to.
I just like coming out of winter, I was like, my skin changed.
Yeah.
And I was like, what is going on? I'm breaking out, like all these things. And so I just had to tweak my skincare a little bit to welcome in my spring, summer
Exactly.
skin. Yeah.
I just think people are so like, I used this 10 years ago and I loved it and I'm never going to stop. I'm like, we were all using St. Ives like peach scrub on our face like 100 times a day.
Yeah.
So I say kind of switch things up. I was using toner pads every day and my skin had never looked worse. And then finally I did some research. Okay, oh my gosh, you're like taking your skin barrier off every time you use that. Okay, now let's put some good stuff in and put it back. I just think you can ebb and flow and you don't have to be trendy. The stuff I use is not top name, top dollar. It is very affordable stuff, but I'm just kind of working with what my skin wants in the moment, and I think that's okay.
Mhm. I like that.
Yeah.
Yeah, because like I said, I just went through a whole thing recently with
Yeah.
the season change. And another thing too is I was in this point, which I think TikTok did a lot of it,
Mhm.
watching influencers with their
Oh,
skincare
yeah.
routine. You're like making notes, writing stuff
I
down
know.
of like, what do I need to get
Makes
to
me
be
sick.
beautiful?
Yes.
And, there's like 15 products in their regimen. And I think that's another misconception is like everyone thinks that you have to have like a 15-step skincare
Yes.
routine night and day. And really, like, I think I use 3 products
I think
in the
that's more
morning.
than fine because your skin looks
And
great. You
yeah,
look beautiful.
thank you.
I just think that's the problem is women get so scared by this and they're so overwhelmed. They're like, how would I ever do this? I don't have time for a 15-step routine. These girls in here like with their freaking things.
And then they're
I-
slapping it on
I'm
their
like,
face.
I'm like, I have time. I have
Yeah.
time to wash it, dry it, put some stuff on it, and we got to go. We got
Yeah.
patients to see. So, and I won't say that I'm like a skincare expert. I've just really taken the time starting this business to do research and to really make sure that my patients have the best outcome going forward. So if they have a question about stuff, all my patients send me their skincare routine bottles and I'm like, yes, no, you don't, why are you doing that? You don't need it. Stop spending money on it. We don't need to overcomplicate it or overspend either.
What are your ultimate anti-aging advice, hacks, aside from the regenerative medicine?
So I would say this, I'm going to go pretty cliche here, water. God, just
Water.
drink
Okay.
freaking water. I have a Stanley cup and I probably drink 6 Stanley cups a day. I'm always drinking water. I will say the one thing that I've done probably for the last year is, again, you're gonna be like, oh, she's hokey. Bone broth. I mean, I'm not kidding you. I
Ooh.
start my
And it
day.
has collagen in it too.
Yes.
Natural like bone broth has collagen.
Yes.
Yeah.
And I use it's like Dr. Amy something, I think. I find hers on it's at Whole Foods, they sell it, or on Amazon. There's packets. I start my day with one of those. That's 15 grams of protein in the day.
Mhm.
And I can tell a difference. I'm not kidding, in my skin, in my gut, in my anxiety, in my stress levels when I do that regularly. So I would highly recommend that.
It's great for inflammation too.
Yes.
Like
Oh my
like
God.
throughout your whole body.
Yes.
Because
And
you're talking like you drink it, right?
yes, I
Yeah.
drink it. If I'm feeling frisky, because I'm too lazy, Target makes these ginger cubes. Have you seen these?
No.
It's grated ginger, and they make them in the form of ice cubes. And you just pop out a grated ginger cube, and I like ginger, but
Oh.
ginger's a fantastic,
Like in your water or something?
yeah,
Okay.
fantastic anti-inflammatory. So if
Wow.
I feel like on my period, bloated beyond belief, my eyes are puffy, my face is puffy, I want to kill everything that moves, I'll snap a ginger cube in some bone broth, maybe put like a little squeeze of lemon and down it. And I'm not kidding you, within like 30 minutes to an hour, fantastic.
Yeah.
I also say the same thing about like a good greens powder. I like a good greens and reds powder. I've tried a bunch of brands. We do the one from One Up Nutrition. I love it. I've done that for 3 years. And then I would say, it sounds so crazy, but like take an hour like on your weekend and grab a book and go somewhere you love to go and like spend an hour just on yourself doing something that makes you truly happy. We get so caught up with our 9 to 5, and I'm bad about it. Going be like, I have to get this done and this done and this done and this done, and then then it's Monday. And we don't ever take time to just like sit and like be with that moment. And I think since I've started allowing myself to do that and not feel bad for not booking every hour of the day solid, I just think that's way. I mean, in my opinion, people can argue with me or say, "Girl, you're kidding." I look better at 27 than I did at 2021.
Yeah.
And thank God,
I've been saying that. Like I have aged in reverse, I think. You look at pictures of me 7 years
Really?
ago, 5 years ago, I'm like, my skin's horrible. I look older.
Ye
Like my
it's
face looks old, like I
weird,
wrinkle,
isn't
more
it?
wrinkles, everything. And I get Botox maybe twice a year.
Nice.
Maybe.
That's nice.
And now I'm gonna be doing PRP. So I
Yes.
might not even need it that much.
Yes.
But
And
like
that's the thing
it's
is like my patients, the biggest thing when I have patients that come in, I always text my patients, follow up. How are you doing? How are you feeling? What have you noticed? What have you not? Because the last thing I want is for someone to be unhappy. If you're unhappy, we will fix it together. But they're like, everyone keeps asking me like why I'm so glowy. Like truly, this just gives you such a natural glow about you from the inside out. And the only thing you have to thank is your own body. Like, how kick ass is it that our own body is able to do things like this? Like, I'll
Yeah.
never get over it. But I think that's why I love this so much and I'm so passionate about it, is because we don't give our bodies enough credit. And I think we blame them for things as we age. And we just don't have to. Like, our bodies are kick ass and they can do all these things. So I think in the future, I'm really looking into cellulite, getting rid of cellulite with
girl,
PRP.
I'm first on your list. If
I'm looking at it. I'm really researching it.
Yeah.
But if we can do all this stuff, I've said this for a long time. I think Western medicine will be kind of obsolete in 10 to 15 years. And I think we'll gravitate more towards stuff like this. It's a little taboo, uneasy right now. But I think
I'm there. I'm like trying to bring all the listeners
Yes.
with me.
I so
If you've listened to the
appreciate it.
podcast, like you already
Yes.
know, I'm like with my guests that I have are all similar to you and how you are with like it starts from the inside out.
Yes.
Heal the gut. Take time. Just breathe.
Yes.
And I mean, you'll age backwards, literally.
Absolutely. And I'm not one of those people that stand up here and they're like, I don't drink or I don't like you saw me at my wedding. I love a tequila.
Your wedding was a blast.
My God.
I was like ready to dive right into.
I cannot believe when we looked back at the video, some of the stuff people were doing, but I think everybody had a great time. So thank God. But yeah, I just think if you do things, if you can do anything to your body that uses your own body, you are going to win every time. There's no risk of rejection. Literally the only risk with all of these procedures is redness or irritation at the injection site.
Mm-hmm.
That is it.
Yeah.
You can't reject your own body.
Right. And you might not be able to go out the very night that you get it. But
No.
other than that.
We're golden.
Yeah. I love it.
Thank you.
So let's move on to talk about you have a grand reopening happening.
Yes.
You got promotions that will be taking place there. So if you can go into that, like when it is, what's going on, what are the promotions, and like where people can go if you're local to St. Louis.
Yes.
Because it's in person, right?
Yeah,
like,
absolutely.
Okay.
Absolutely. So we're actually like just down the road here. We're at Olive and 141.
Oh, okay.
Cake.
I don't think I realized it was that close.
No, super close.
Okay.
I didn't realize either. And I was actually just at this Starbucks right here last Friday. And I was like, I didn't even notice. I didn't even notice. Like, look at me.
Small world.
Yes. So yeah, we're at the corner of Olive and 141. We are doing a grand reopening. We were corporate. I'm at the Ozzie Smith Center as a nurse practitioner for the ortho. I have my Maddisson office in that clinic. And we were under corporate the beginning of the year. We have since gotten away from corporate. We're under private ownership. Our owner, Jason, is fantastic. He's wonderful. And so we just felt like we wanted to celebrate this. This is like a huge milestone. He's done so much work with the clinic. I've done so much work on the aesthetic side. And so we really just want to showcase that. So on September 19th, times are still being finalized, but it will be on my Instagram. We are going to do a grand reopening, have a bunch of local vendors from Chesterfield, just people in the kind of health and wellness spectrum. So if somebody comes in and they're one of my patients who sees somebody for aesthetics, we're going to have people from, like places like Fit Flavors. If they're trying to like change their life, it's just going to be a network of health and wellness, supplement superstores, IV nutrition, stuff like that. Again, times are we're trying to figure everything out right now and get signage and stuff up. But please come in person, see the clinic, be able to see what we have to offer. And then we are going to do promotions. We are also in the works. I don't want to say too much, but I am trying to get some off-site privileges. So if women want to book parties at their house with their friends and have me come, all my stuff is travelable. So we're still working on that, but all the promotions and everything will be on my Instagram.
I love it.
Yes.
Titties for everyone. I'm gonna have a party.
Boobies. Boobies. I had a patient go, can I get my boobs done that day? I'm like, you want to do it like
on
live?
the party?
You want to do it like live in front of all these people? She was like, well, I don't care. I'm like, okay, we're not going to do anything live, but yes, you can have your boobies done anytime you want. Anytime.
Yeah. Awesome. Well, I will definitely be there.
Fantastic.
Because thinking off the top of my head, I think I'm in town September 19th.
Fantastic.
And I am so excited.
Would love to have
I
you.
would love to come.
Yes.
So I will be there for sure.
Perfect.
Let's go ahead and talk about your website,
Yes.
social media, where people can find you.
Yes. My website is maddaesthetics.com. That's mad with 2 Ds. My Instagram is @_maddaesthetics. And then, like I said, my ortho company is the Ozzie Smith Center. And you can find us on Facebook and Instagram @Ozzie Smith Center. And yeah, I think that's it.
Awesome. Well, thank you so much
Thank
for
you.
coming. This has been so fun.
I know. And I've
Yeah.
just missed you terribly.
I
I mean,
know.
it's
We
been
need
too
to-
long.
I mean, we're this close now that we know we need to grab a drink sometime or something.
Absolutely. A tequila for sure.
Well, thank you.
Thank you so much. I appreciate it.
As always, I appreciate you all so much for listening. My goal is for these episodes to at least help one person in some aspect of their life. So if you like what you hear, don't forget to follow, like, subscribe to the show, as well as follow us on social media @InsideVoicePod. Thanks.